Hello, this is Dr. Ross, and this is the second video lecture in the axial muscles presentation series. This is for both mine as well as Dr. Camp's anatomy and physiology class at Lee College. So now we're going to talk about muscles that move the pectoral girdle. So they're going to result in shoulder movement. So muscles that position the pectoral girdle are located either on the anterior thorax or on the posterior thorax. And we're going to start talking with the trapezius. Now, before I move forward, I want to remind you guys that when we're looking at these illustrations, we are looking at different depths of muscle. So in this case, on this on the left-hand side of the image, we have the trapezius muscle. It's also present on the right-hand side. It would be a mirror image of that. But it's removed so we can see the muscles underneath. So I want you to keep that in mind as we move through these images. So the trapezius is one of those muscles that is named after its shape. And if you can imagine the other side there, it's supposed to look like a trapezoid. I think that's pushing it a bit, but still, that is what the trapezius muscle is named after. It's a very large muscle. It elevates, depresses, rotates, and retracts the scapula. Which is our shoulder blade, right? So the origin for the trapezius is shown here along the midline. It's the occipital bone, which you can see at the top of this image, as well as the spinous processes of several of the thoracic vertebrae. All right. Now the insertion is more lateral. The insertion is the lateral third of the clavicle. So if you think about where the clavicle is, it's about the last third as you move away from the midline. It also inserts at the acromion and scapular spine of the scapula as well. Next, I want to talk about the rhomboid muscles. So these are the rhomboid major and rhomboid minor. This is going to be a muscle group named after the different muscle sizes as well as the shape. So we have a rhomboid-like shape. The large one is the major and the small one is the minor. All right. So when the rhomboids contract, your scapula moves medially, which can pull the shoulder and the upper limb toward the posterior side. For the rhomboid minor, the origin is the spinous processes. Remember, these are those processes that protrude from the back of each vertebra. You can feel them when you move your finger along your spine. So the spinous process is going to run through, they're going to attach to the spinous processes of the C7, cervical vertebrae 7, through thoracic vertebrae 1. That's just for the minor, and it's very small, so that makes sense. The insertion, so if you follow the insertion down, that's going to be the medial border of the scapula. The rhomboid major, the origin of this one is going to be, of this muscle, is going to be the spinous processes of thoracic vertebrae 2 through 5. And the insertion is going to be the medial border of the scapula. Same as the minor, it's just going to be a little bit further down. Next, the levitator scapulae. This is going to rotate the scapula and lift the scapula. The origin here is going to be cervical vertebrae 1 through 4, which you can see near the top of the image. And the insertion is also on the scapula. So in this case, we're talking about the superior part of that medial border. So the rhomboid, major, minor, and the levitator scapula are all going to insert on that medial border of the scapula. Next, let's move on to shoulder movement. Another muscle that is involved in moving the shoulder is the serratus anterior. This muscle pulls the scapula forward around the rib cage, and so it's also referred to as boxer's muscle because of this. It stabilizes the scapula as well. And this one I've got this rotating image because it kind of wraps around from the back to the side. Now this one, as I mentioned, is called the serratus anterior, and it has that name because if you look toward the front of this muscle, it has that jagged appearance, which is kind of like the serrated knife. So that's also a good way to remember this muscle. So again, this pulls the scapula forward and around the rib cage when someone throws a punch. Again, so sometimes it's called the boxer's muscle. The origin is the medial border of the scapula, and the insertion is going to be ribs number 1 through 8. Finally, the posterior muscles that move the shoulder that I'm going to talk about are going to be the pectoralis minor muscles. These are going to be deep to the pectoral major, and they basically join the shoulder to the rib cage. When they contract, they're going to abduct and depress the scapula. The origin, as you can see here, is the coracoid process of the scapula, and then the insertion is ribs 3 through 5. And that is it for this second presentation.